is giving an update on the pandemic from Geneva. Let's listen in.
Today, countries came together not only to pledge their financial support, but to also pledge their commitment to ensuring all people can access life-saving tools for COVID-19. Accelerating development of the products, but at the same time, access to all. Recent advances in science are enabling the world to move at incredible speed to develop these tools. But the true measure of success will not only be how fast we can. None of us can accept a world in which some people are protected while others are not. Everybody should be protected. None of us are safe. Action of COVID-19 across the globe demands that working with all countries and partners, equitable distribution, a common future, a future in which all people enjoy the right to the highest attainable standard of health and the products that deliver that right. That's what we mean by health for all. We have been saying it for the last more than 70 years since the WHO was created. But I think, given the experience we have now and the difficulties we're going through, it's time to make it happen, health for all. But one of the best tools is also one of the most basic: clean hands. The simple act of cleaning hands can be the difference between life and death, and remains one of the most important public health measures for protecting individuals, families, and communities against COVID-19 and many other diseases. Tomorrow is Hand Hygiene Day, a reminder of the importance of cleaning, that millions of people around the world are not able to practice this most basic, kept with hand hygiene stations. And three, is an old problem that requires new and vastly increased attention. If we're to stop COVID-19, dramatically increase investments in soap, access to water, and alcohol-based hand rubs. Tomorrow also marks the International Day of the Midwife. This is an opportunity to remember the vital role that midwives play all over the world in providing safe and effective care for women and newborns. Research shows that interventions delivered by midwives can avert over 80% of all maternal deaths, stillbirths, and neonatal deaths. The service of midwives is actually a lifeline for many. Childbirth can be one of the most precious moments in a woman's life, but it can also be one of the most dangerous, as you know. Midwives are essential for guiding and caring for women through their entire pregnancy and the critical moment of childbirth. But we need more Hand Hygiene Day and tomorrow to clap for nurses and midwives and thank them for their role in delivering.
On the global pledging online conference that having a short amount has now been collected to try and move forward and find a vaccine, and also use that money towards complementary therapies, medicines and remedies to try and combat COVID-19. He also touched on the fact that tomorrow, Tuesday, will be International Hand Hygiene Day and also International Day of the Midwife. Now, the hardest-hit country in the Middle East is reopening some mosques, but Iran's capital, Tehran, remains a virus hotspot. President Hassan Rouhani says social distancing is more important than collective prayer. Zain Basrawi is in the capital.
Iran's government has announced the names of more than 100 towns and cities across the country that they now consider safe or white zones. These are places that health officials say have seen a dramatic drop